Yeah, thank you very much for coming for this meeting. If you can please mute for now, if you're not speaking, that'll be very helpful.
Keep your notes.
Yeah, and if you have any questions at any point, please just put them in the chat and we'll pick them up and either answer there or address it at the end of the presentation. My name is Teddy. I'm a clinical research fellow with the Global Surgery Unit in University of Birmingham. So you would all have received a welcome pack from us, and we'll be sending in your logins for the mini team registration in the next 48 hours. This would either be in your inbox or go to your spam or junk mail. So you need to have a look at that over the weekend or early next week to register your mini teams. So I'm just going to briefly go through the study summary, as this is our first webinar. Just a quick overview of the study, the sub-studies, and then we'll zoom into RedCap and mini team registration. I know there will be lots of questions. If you have any questions, just drop them in the chat, or you can ask at the end of the presentation. We would have subsequent hospital leads meeting where we'd clarify a lot of or go a bit more into details with regards to certain aspects of the study, like the CRFs and data points, etc. So this is just a meeting to just give a summary of the study, and then we'll go into how to register your mini team in your hospital. Okay. So in briefly, the aim of this study is to identify areas where we can strengthen emergency care systems, and then also to make recommendations to improve the emergency care pathway across the world. And our secondary aims are to evaluate variations in presentation, diagnosis, management, and access to minimally invasive surgery and outcomes for patients who undergo appendicectomy. Now, we understand that to evaluate emergency healthcare systems is a very complex thing, and there's no single outcome measure that can give us a full picture of care pathways. And because of this, we, with the help of a diverse steering group of surgical and perioperative care practitioners with representation from different countries across the world, we defined key performance measures through an online prioritization exercise. So then we ended up with 8 core outcome measures, or 8 key performance measures. Now, these are the outcome measures that would be assessed in the AlliGatOr cohort study. And we aim to start patient inclusion early part of next year in February 2025. So these 8 core outcome measures, I'll come to them in a bit, have been mapped to the WHO Health Systems Framework of Access and Coverage and Quality and Safety. Now, for access and coverage, we are looking at the time from when a patient had symptoms to when they were first seen by a surgical team. Now, this gives us a direct measure of access to timely, essential surgical care, and it broadly estimates the presence of a functioning or comprehensive care delivery system. We're also looking at perforation rate, and we are looking at imaging rate, how many patients had pre-operative imaging, and then also access to laparoscopy. We're looking at proportion of patients who had their surgery laparoscopically or even robotic. Now, for quality and safety, we're looking at the in-hospital delay. So time from when we made a decision to go to theater to when the patient actually had surgery. And then we're also looking at negative appendicectomy rates, which gives us an indirect measure of lack of diagnostics or quality and safety of a service. And then also length of hospital stay and complication rates. Now, we in terms of eligibility criteria, both adults and children would be included. And we're only looking at patients who've had appendicectomy for suspected or confirmed appendicitis. So and we're also looking at interval appendicectomy as well. So if a patient gets or has an appendicectomy as part of, say, a cancer procedure, they will be excluded from the study. Or if somebody had, say, appendicectomy in the past, but then they represent with stamp appendicitis, those patients will be excluded from the study. Any surgical approach, open or minimally invasive, is eligible to be included. So this is just a flow chart showing the exact same eligibility criteria and what kind of information we intend to collect from patients. Now, as part of this sub-study, as part of this main cohort study, we are including two sub-studies, one on financing and one on waste management and sustainability. Now, these sub-studies will be in selected sites. So for the financing sub-study, so this is looking at evaluating catastrophic expenditure in patients who are undergoing appendicectomy. And then we'll also look at cost of open versus laparoscopic appendicectomy. And then for the waste and sustainability sub-study, we are looking at characterizing current sustainability practices in operating theaters across the world with a focus on waste management. In terms of data collection, we're going to collect data from a patient perspective and then also from a hospital level survey, which will be completed by the hospital leads. Now, for the patient level data, for a center that's only part of the main cohort study without doing the sub-study, you would only use the first CRF1. If a center is taking part in the sub-studies, then that means for each patient, they would need to complete 2 patient-level CRFs, one for the main sub-study and one for the main study and another for the sub-study. Like I said, we would come to this in a subsequent hospital leads meeting where we'd explain or go through the CRFs into detail. At the hospital level, would take the mandatory site survey. So any hospital that is part of AlliGatOr study would have to, the hospital lead would have to complete a mandatory site survey. But then we also have an optional WHO emergency assessment too. That is entirely optional. We would encourage centers to take that survey, but it's not mandatory. Because we have allowed for hospital leads and co-leads, it might be worthwhile for one of the leads to complete one of the site surveys. So this is our project outline, and at this point we are at registration of the hospital leads, and then also we are moving on to mini team registration. So we'll be sending the logins to you to register your mini teams, but we thought it would be good at this point to show you how it would look like so you can complete that once you set up your logins. Okay. I'm just going to go here. Okay, so once you get your logins, okay, I'm gonna log in with my test. So you would receive logins with username with .app at the end. And that's just because some of you have been involved in previous studies like Gecko, Hippo, and you might have other usernames. So just to make it distinct, we have this .app, which will be your login for the alligator study. So once you log in, you would come to this page, My Projects. It may send you straight here to home, but then you go to My Projects, and then you come to the particular mini team registration portal. Now, the registration portal, we've created two of them. One is for Africa and Europe, and the other one is for America, Asia, and Oceania. So you need to select which one applies to you. Actually, it's just the one that applies to you that would show up anyways. So I've registered as a country from, as a hospital from Ghana. So it's automatically allowed me access to this particular project that's in Africa and Europe. So when you click on that, you would go to Record Status Dashboard. And then you go to your particular record. So I'm going to go to this record. And once you go there, you'd see that your hospital would automatically be filled in. And then depending on the information you gave when you were filling in your expression of interest as to which patient group you would collect, that would also automatically fill up here. If there's any change in that, and you need to let us know. But if you filled in the expression of interest form correctly as to which kind of patient group you want to include, then that will automatically show up here. Then the next thing is for you to select which kind of hospital or what type of facility you work in or where you'll be collecting the data. So if it's a referral facility, you select that. Whatever kind of facility it is, you select that. Then the next part is study approvals. So we expect that before any patient is added onto RedCap, you would have had study approvals before doing that. I appreciate that at this point, a lot of people wouldn't have. A few hospitals have had approvals, but majority of you haven't had any approvals. So you would click on this one that says that you have applied or you're in the process of getting ethics approval. You've not had it yet. We understand that. But then you would only upload patient data after you've had approval to do that. And then that would let you progress to the next step. So if you say you've not received any approvals, then it's not going to allow you to proceed. Okay. All right, my RedCap is. I'm just gonna reload this. So essentially, after agreeing to the study approvals, it moves you on to the next point where you enter your details as the consultant lead. And this is quite important very important because this is the information that will be used for authorship. So the name has to be correct. And then also the next thing is your ORCID ID. So the ORCID ID, if you do not have one, you need to generate one. And there's a link at the bottom, a site at the bottom that helps you to create your ORCID ID, and you put this in here. And then of course your email address as well. And the same information for the your co-lead, first name, last name, ORCID ID, and email address. Preferably, if the email is a Gmail account, that would be quite helpful. So if you have two email addresses, one is a Gmail, would prefer if you use the Gmail because it helps us on the side. Now, after you've done that, entered your details, your ORCID ID, which is important for authorship, and then same for your co-lead if you have a co-lead. The next thing is to select which period of the data collection you would be taking part in. So now we have 8 data collection windows, 2 weeks, 2 weeks, 2 weeks, 8 of them. And as you can see here, if you have different teams for the different periods, you need to fill in your team information, or which people are in your team, your collaborators. You need to fill that in. So for instance, if for period 1, I click on period 1, it's going to give me my 3 collaborators, and you need to fill in their details as well. Now, this is also important because this is what we use for authorship. So it is worth checking with them exactly what order of names you'd want to use for this. And they also need ORCID ID. So if you have your collaborators not having ORCID IDs, they would need to register and get an ORCID ID, and then you can put that information here. It's quite a very simple process to get an ORCID ID in case anyone doesn't have. So you do this for all your collaborators for that particular period. If you are using the same people for all the periods, you can just fill in the same details. But if you're using different collaborators for the different periods, then you need to fill that in as well. I'll pause here, and if there's any burning questions.
Teddy, thank you very much. I think it would be useful to just go through, I've been replying in the chat of some questions, just to confirm with you some of the questions, which was, so just to be very clear, alongside everything you've explained about team registration, each hospital lead is responsible to get ethics approval, or the approval that is indicated in your own settings. So this was a recurrent question coming in the chat, so I thought it was just important to highlight. And then one of the questions here, which I think is also important, people are asking if they need to send the ethical approval somewhere, or if it is submitted somewhere.
No, you just need to get the ethical approval. You don't need to send it to us.
Okay. And then there are some questions around the welcome pack. So there are some hospitals that have been confirmed, but they didn't receive the welcome pack. As far as I'm aware, the welcome pack contains the protocol and all the supporting documents, which can be found in the website page as well, which I've shared the link in the chat. Is that correct?
Yes, please. Thank you.
Okay.
And for those who are waiting welcome pack, it's for some people it's because you've had more than one person from the same hospital expressing interest in the study, and we need to sort out who should be, because we can only have one hospital lead, and that's why it's delayed a bit because of duplications in expression of interest. So once all that is sorted out, we'll send the welcome pack.
Yeah, okay. I think it would be good to hear the 2 hands up from the hospitals that have some questions, and then I can ask you a few more questions that are on the chat.
Okay, thank you. If anyone has any questions,
I can see who his hand up in case it helps.
Oh, yes,
so
please.
I have Omo, sorry if I'm saying this wrongly, Omolola.
Yeah, thank you, Maria. Can you hear me?
Yes.
Yes.
All right, great. So thank you very much, Teddy. I'm a colleague from Federal Medical Center in Yobe District, in northern part of Nigeria, and I'm Dr. Merola Shekofumi by name. So, my question is this: can you hear me?
Yes, it's a bit faint, but I can hear you.
Oh, great. How about now? Is it a bit louder?
Yeah, if you ask the question, please.
Okay, so my question is on the OCAD ID. I'm currently participating in a global outcome of abdominal laparotomy with another study with Cambridge University, and I also have the same challenge with the OCAD ID while trying to register. And the challenge is, while trying to register for the OCAD ID, the name of my hospital is not showing. So I would like to know, probably there is something I'm doing wrong, or there's a way you can
But
assist
it's
that.
for fucking fossil ID.
Sorry, I didn't get the last part. You are struggling to get an OCAD ID.
Yes. So the name of my hospital is not showing in the tabs where I'm supposed to fill the name of the hospital while registering.
Oh, okay. So that sounds like a peculiar issue. I mean, I could go through that with you after. If
Okay.
you're on the other pages, we could go through that after.
All right. That's
Okay.
my first question. Thank you
Yeah.
very much. You said if I'm on what page, please?
If you're on the Nigerian page, Emmanuel has access to the page, so we could sort that out after.
Oh, I'm not on that page. Maybe you can just send me a private chat in this meeting so that maybe the link or something that I can join.
All right. Yeah, or you can just send to this email. I'm just putting that there.
All right.
All right. What's the second question?
Now, the second question is the RedCap. I'm currently, the study I mentioned is still on and it's going to be concluding by December. So I have a RedCap login. So will that affect this AlliGatOr study when it starts, or it won't be a challenge?
No, it shouldn't be a challenge. We'll give you logins for AlliGatOr. So just to make things easier, everybody should use the AlliGatOr logins we provide.
Oh, beautiful.
Yeah.
Beautiful. Thank you very much. That will be all for now.
All right. Thanks. Sorry, I can't see the hands up here.
Yeah.
So
Hi, Popescu from Lugano, Switzerland. Can you hear me?
yes.
Yeah, thanks. Two questions. One, can we participate in more than one periods, and should we declare that from the beginning? Then the second question is when will you provide these logins, after or before we take the ethical approval?
All right. Thank you very much. So first question, yes, we encourage everyone to be part of all the periods for data collection.
All right.
That's actually very useful. Secondly, we aim to send the logins in the next 48 hours.
Perfect.
Yeah.
Okay, thank you.
And with regards to ethics, you can start application for ethics. You don't need to wait for logins.
All right. Yeah, sure. We already did. My question was if we will receive logins after we have taken but you responded. It's okay. Thank you very much.
Yeah.
Okay, thank you. Jersam?
Thank you very much. This is from Ethiopia. I'm not sure if I missed because I had a phone call in between and I was using my cell phone. So my question is with regards to the mini teams that we are going to create, and my question is with regards to the periods of data collection. So is a hospital allowed to collect data for more than one period? And along with that, are we going to can we add more collaborators for each period. That means a different collaborator for different period of data collection. Thank you very much.
Okay, thank you. So the answer to both of them is yes. You can take data for, or we encourage you to actually take data for all the 8 periods, and you can have different mini teams for the different periods, or you can maintain the same team. So if you can see, I'm not sure if my screen is still sharing, but if you can see from the mini team application, you have these options, period 1, 2, 3, 4, 5. So you can choose all the periods, and then that means you're taking part in all the 8 periods. And each period you have you need to enter the collaborators who are helping you for that period. So for period 1, you have collaborator 1, 2, and 3 and their details. For period 2, you have the same collaborator. You need to put the collaborator information just like you did for the first period. So if you are using the same collaborators for all the 8 periods, then it will be the same information throughout. But if you change collaborators, or if you have a lot of residents or junior doctors and they all want to be part of it, you can just put them into different periods for data collection.
Thank you very much.
Somebody's asked a similar question I just seen there, if there's a minimum number of patients to include. So this would be consecutive. So during that particular data collection window, you would need to include every patient who is having appendicectomy for appendicitis. Yeah. Is there any other question?
Yes, there is from more people. Julie?
Hi, from the United States. Is there a contact that we can reach out to for a data use agreement in addition to our ethical approval?
Yes, please. If you just send an email to our alligator@globalsearch.org, I've put that email in the chat already. If you just send an email to that, our legal team will get in touch. So we have a draft data agreement, data sharing agreement already in place. But I do understand that for some particular facilities or hospital, they might want certain things that are tailored to what the hospital needs, in which case we would work with them on that, but we would have a draft that we can share with anyone who needs it.
Usra? Usra Omara? Sorry if I'm not saying this correctly.
Hello, can you hear me?
Yeah.
Yeah, I'm Shira from Sudan. I have 2 questions. The first one is, I'm the co-lead in my hospital. While I'm logging into RedCap, I will be as a collaborator, or where should I log in? This is my first question. And the second question is, ethical approval. Shall I get it from the Federal Ministry of Health, or only from the hospital? Thank you.
Thank you very much. I think with regards to your first question, both the lead and the co-lead would have access to RedCap to register mini teams. You'll be in the same data access group, so you should have access to be able to do that. That shouldn't be a problem. The second question, ethics will be according to what is required locally. For some places, they would require a national approval and a hospital level approval. For some places, they just need a hospital level approval. So it depends on what is your local requirements. If you have any, or if you're unsure whether you still need national in addition to hospital, the best thing will be to get in touch with your national lead, Ahmed and Fladloa, and they should be able to help guide what you need locally. And you can get their details on the website.
Yeah, thank you. But I asked if I am a co-lead. I will be a collaborator too, or am I just a co-lead of supervision of the collaborators only?
No, you can be a collaborator if you wanted to. There's no restrictions to that.
I think one thing that might help Uzra is so if you want to be listed as both lead and collaborator, please add your details as a collaborator as well when you're registering the mini team. In terms of the authorship, you will be recognized as a co-lead of your hospital. And then if your name is also on the collaborators, then you are also recognized as a collaborator. I hope this helped a little bit. Okay. Mary Joy.
Hi, I am from the Philippines. Our hospital right now does not have ethics review committee. Can we ask for another institution to have the ethics approval from another institution, ma'am? Thank you.
Okay, I'm not sure exactly how things work in Philippines. I know Mela, who's the national lead, has already started national approvals for Philippines. I think it might be a useful to
Teddy,
get.
I will get in touch with Mary Joy for this issue. Thank you.
Thanks, Mela.
Thank you, ma'am. Thank you, sir.
Okay, perfect. The next one that I have here, Jalal.
Yeah, hello, this is Jalal from Saudi Arabia, Specialized Medical Center. So my question was about the IRB. I sent and requirement needed in our hospital. So in that same email you mentioned before, but we didn't get an answer until now. So the questions was, do we, this research have a fund? So these questions must be answered to get the approval through the IRB. This is the first. The second, we need the CVs of the main investigator for this research. So if you can answer us in the mail, it would be more than helpful. Thank you.
Okay, thank you. I'll have a look at it.
Okay, Mr. Shami.
Yeah, hello, Mr. Shami from Maxfield, the United Kingdom. My first question is, I haven't or I can't see the project of AlliGatOr in my RedCap. I'm a co-leader, so when can I see it? Thank you.
Sorry, we've not sent the logins yet. When we do send the logins, you'll be able to log in and complete the registration.
I have the login.
I think you might have the login probably from participation.
I have the login, yeah.
Studies.
So I think you've been involved with previous studies and your logins are for those previous studies. So what I'm saying is we would send logins for AlliGatOr, specific logins for AlliGatOr, and you would use those ones instead.
No, actually, I use this. I get samashami.app. This with the AlliGatOr you said about this suffix. So I have this login for this. Is that true or not?
So usually for all the new projects, we issue new logins. So for AlliGatOr, Teddy will issue the logins to all hospital leads in the next 48 hours. So you probably will receive a new account, and then it's from that new account that you will be able to see the AlliGatOr study.
I'm already logged in to this new account.
But probably that was not from AlliGatOr, was it?
It is from AlliGatOr. It is the
Shami.
new password.
All right. So Shami, in the next 48 hours, if you've not seen the mini team or the mini team, please get in touch. Okay.
Okay, no problem. No worries. Thank you.
Thanks.
Thank you. Mazuz?
Hello, everyone. I'm Mazuz from Algeria. Actually, I'm a co-leader for my ex-hospital. I work now in a private clinic, but I have the ethical approval from my ex-professor to work with them. Is that normal?
So if I get you are no longer in a particular hospital, but then you
Yes.
are a co-lead in that hospital.
Yes. And my professor is the consultant. Yes, the leader.
And he's happy to include you as a co-lead for that
Yes.
hospital.
Yes.
I think that should be fine.
Yes. Thank you. Another question. Actually, I have the ethical approval verbally. I didn't sign anything. Is that okay?
No, there should be a document to actually say you have approval to take patient data.
Yeah, from the hospital administration or just from my professor and the community?
I think it's what is accepted locally. So like I said, for some people, they might need a national approval. Some people would need a hospital approval. But for most hospitals, there should be an ethics board or data governance team in the hospital that should give you approval to actually.
In our case, we have a medical council that it can approve this. It's just a local.
Then if that is what is required locally, then that should be fine.
Yes. My final question, and sorry, I took a lot.
That's all right.
Thank you. As a co-leader, I will do all the work. The leader cannot, for a lot of responsibilities, he cannot work. So I can take all the job of a leader, but I am also a co-leader. Sometimes I get emails from his behalf. Is that okay?
So the people responsible for the study in your hospital will be the consultant lead, and he should be in agreement to take responsibility for everything that has to do with the study, even if you are answering his emails. If I understand what you're saying, then that should be
No. I don't answer his emails. I mean, I work with him. He see the email, then I work with him.
All right. As long as he's consultant responsible for the study and he's agreed to that, then that's fine. Oh, Maria, do you have anything you?
No, I agree with that. If the consultant that is leading the study with you is happy with that management style, then everything is fine and no problem. I was just going to raise a point, which is the approval that you have from this hospital only allows you to collect data from that hospital. I think it will not be applicable for you to collect data from the private hospital that you said that you moved to.
Yes, I will not collect data from my private clinic. Yes.
Okay. Yeah.
That's
okay. Just clarifying. Yeah. Okay. Perfect.
Thank you.
Thank you. Hamad?
Hello, everybody. Good evening.
Oh.
I'm Mohammed from Jordan. I'm a co-lead at my hospital, and I want to ask about a couple of questions. The first one, should we decide which periods that we want to participate in now, or we can decide that during time, just before the period by 1 or 2 weeks? And let's say that during the period we did not encounter enough patients with appendicitis. Is that okay or not? The second question is that can we add more teams during the course of the study, or should we add all the teams right now?
I think if you have the teams, you can add them now, but then at least add the teams before data collection starts. You'd need to add your team. That I understand that for some people, you might have doctors who are rotating and might not be around at the time when data collection starts. So you might want to wait a bit and then fill those in once data collection starts. But if you do have a team that will be there during the time when data collection is ongoing, then you should fill that in now.
Okay, let's say that I have decided to participate in 2 periods, and in the middle of the study, I decided to add another period. Is that okay, or we cannot do that?
You can do that as long as we've not got into that period.
Okay, thank you, sir.
Okay, thank you. Ahmad?
Right, thank you so much. Ahmad is there. So, okay, so thank you so much for the webinar. It's nice to see many old friends on the group again. And my name is Ahmad Uzair, and I will be the national lead for the Pakistan. Just a small comment. Since most of the ethical approval systems are different in different countries, it would be better if all the hospital leads should contact their national leads for the ethical approval pathways, so it would be easier for everyone to solve these problems. The idea of a co-lead is interesting, and since there are so the appendicitis would be commonly presenting in many hospitals. So, do you think that this would increase the number of the researchers in terms of leads and co-leads? Because you're nearly doubling the number of the people who are in charge. So, any specific reason for having co-leads in this specific project?
Okay, so the reason for having co-leads in this particular project was we decided to have like a main lead who should be a consultant, and then a co-lead who could be either be a consultant, a resident, or even a medical student. And the reason for this is we need a consultant to be responsible for the study in a hospital. Otherwise, you end up with maybe a resident or even a medical student in certain cases being responsible for the study in a hospital, which might not be so good in a sense. And recently, we've had like most of our hospitals or even countries are now having very stringent criteria for ethics and sort of, so we thought it's best to have a consultant lead and a co-lead in just to give the other levels participation in the study as well from a leadership point of view.
And would you be having similar webinar with the national leads?
Sorry, I missed a bit of it.
So are you planning for a similar webinar with the national leads as well? Because I think that would be more helpful.
Yeah, we've had 2 national leads webinars already. And yes, we plan to have more national leads webinars and also hospital lead webinars in the future. With regards to the hospital leads webinars, I was saying earlier on that we plan to do this weekly, a 2-weekly hospital leads webinar where you can drop in, ask questions, and if there's anything that is troubling at your site and we could help with, we can help with that. The other thing is we have regional leads as well for 7 regions across the world, and hopefully in the next hospital leads webinars, we would engage the regional leads to help to organize that, because the challenge also is we have these webinars at 2:30 GMT, but then you can't have anyone from Australia or Oceania be involved because of the time differences. But then when we do that regional hospital lead webinars, we can actually get to include everyone in these meetings.
Thank you.
Thank you.
Thank you, Hamad. And I think you raised a very good point, which is if the hospital leads have particular questions related to the locally regulations in terms of ethical approval, most of the national leads already have, I mean, as you already have as well, previous experience in working in these studies. So I think you raised a very good point of the advantage of the hospital leads to get in touch with the national leads. Just to highlight to everyone, the national leads list is available in the website, and you can contact the national leads from there, I think. Is that correct, Teddy?
Yes, yes. And I think for something that's local or something that you're not sure is happening in your country, I think the best point of call will be the national leads. As like Maria said, most of them have been involved in previous projects and have had much experience to dealing with things in your context, your local context.
Yeah. So going for some more questions, we still have a few hands up. So Safa. Safa Abush.
Hello, I am Safa from Sudan. I want to raise 2 questions. Firstly, I don't know the leader of Sudan. Who is him? If we have national leader for our project in Sudan. Firstly, and second thing, the step to approve our participation. As I lead, as a group leader in my region in Blue Nile State in Sudan. Thank you.
Okay, I got the first question. I'm not sure if Maria, you got the second one, but the first one, yes, there are 2 national leads for Sudan, and their details are on the website. You can get in touch with them via the website. We'll put the website link in the page shortly. I'm not sure I got the second question.
Okay, the second question is for my region in Blue Nile State. I am a group leader and I have almost received the email of the backs. But when I checked the list of the hospital, I didn't find my hospital name. I didn't find my name as a regulator or collaborator. Why is that? Thank you.
Okay, so you've not seen your hospital in the list of hospitals, but you've received an email to confirm you as a hospital lead. Is that right?
Yes, I get the email with backs. All the content, the consent for adults, the consent for pediatrics, all the content I have. But when I check the list of the hospital, my name is not there and my hospital name is not there in the list.
Okay, okay. So you received an email to ask you to decide whether you are taking pediatric patients or adult patients.
No, I just received the welcoming email and with the contact.
Okay, if you've received an email to confirm you as a hospital lead, then yes, you should be there as a hospital lead. I guess what's happened is, I'm just going to show my screen shortly. I guess what's happened is when you go to sorry, give me 1 minute. When you go to the expression of interest page, so it lists what RedCap does is it lists the first 600 hospitals, for instance. So if it lists the first 600 hospitals, then that means that if you search in there, you probably not find your hospital. So for instance, I'm just going to show this quickly. If you come here, so this is what you probably see on RedCap. It only shows you the first 1,000 hospitals. So you would need to go to and select all and then search, because if your hospital is in, let's say, number 1,500 or something, then you would not see it when you do the search. So once you go on and you are trying to search, you need to select to pick up or to search through all the hospital list there. So that's probably why you've not seen your hospital.
Okay, thank you.
Yeah.
Thank you. Hamed Sayed Abdo.
Hello, this is Ahmed Said from Egypt. I would like to ask about in many teams, have everyone who gathered the information about the patients upload the data to RedCap themselves, or could it be restricted to the leader or co-leader to ensure that the data which is uploaded is completely correct?
Okay, so the people who would enter the data would be the collaborators. So when you are doing your mini team registration, you'd have to put in the details of your collaborators and their ORCID name and email address, etc. So they would also be given logins at some point, and that login will allow them to enter patient details. If you are a hospital lead or a hospital co-lead and you put your name down as a collaborator, then yes, you receive logins to enter patient details as well.
Okay, thank you. I have another question about following up with the patients. Should it be after the 30 days or during the 30 days?
So usually 30 days.
After the 30 days.
Yeah, 30 days outcome, yeah.
Okay, thank you.
Thank you. Suliath?
Yes, good afternoon, everyone. I'm Suliat from Benin. What I want to know, can a consultant lead more than one hospital?
That is a very good question. Yes, the answer is yes.
Okay, thank you.
Thank you. I'm sorry, I'm sure I will not say this correctly. Iyethar Al-Jubori. I'm very sorry.
You pronounce it correctly. Thank you.
Oh, okay.
Yeah. I'm from Iraq, and my question is, if we don't have a certain period where we can fill in collaborators on, is it okay to leave it out, like period 4 or 6? My second question is, when is the last day to collect collaborators? Thank you.
So the answer to your first question is yes. Collaborators need to be filled in on RedCap before the particular data collection period.
When's the last day to collect these collaborators?
So data collection is from 3rd February to 25th May.
No, I think it's for the team registration, Teddy. When is the deadline to register the teams in RedCap?
Oh, that should be before data collection. So before 3rd February.
Okay, thank you. And can we leave a period out if we don't find any collaborators for it?
Yes.
Okay, thank you.
Thank you. K and Ho.
Yeah. Hi. I have a question. So I registered myself as a co-lead, and for the team registration, should we include the lead and the co-lead at the same time, or can we leave them out?
So you would need to put in the name of the lead and the co-lead. You need to fill that in to progress anyways. So for instance,
Okay.
I'm not sure if my screen is showing properly, but after you enter details of your hospital and study approvals, the next thing is consultant lead and then co-lead if there's a co-lead. So the consultant lead is a must, provide value, but the co-lead isn't, because for some hospitals, they just have a consultant lead without a co-lead. But you can't have the reverse where you have a co-lead without a consultant lead.
Right. Okay, understand. Thanks.
Nice.
Thank you. Hala Mushawe. Sorry if I'm saying this in the wrong way.
Thank you. You said it correctly. Yes, I have one question. I'm from Syria, so I don't know the national lead of Syria. And is there a way to know who is the national lead of my country?
Yeah, it will be on the website, please.
Okay.
Yeah.
If we didn't find a national lead in our country, can we apply for it or not?
Yeah, you can email us with that request.
Thank you. I have another question, please. You say that you will hold another meeting for the leaders of the team. I'm afraid that the consultant will be busy for such kind of meetings. So can I, as a co-lead, attend instead of him?
Yeah, that's fine.
So you will send me the link, right? So you send the link for the lead and the co-lead, right?
Yeah, so we send the meeting links to both the hospital lead and then the co-lead, because we appreciate that sometimes one person may not be available, in which case the other person attends the meeting.
Okay, please, one last question. For the lead and the co-lead, we will be as a co-author or collaborators? I just want to make sure of this point.
Okay, so both the consultant lead and then the co-lead will be recognized in authorship as hospital leads.
Thank you. Thank you so much. I really appreciate it.
Thank you. Just one thing about the national leads, because there was a question related to that on the chat. I think the list on the website is probably not up to date. So we will review it and we will update it as soon as we can. If you need to contact your national lead, if you click on the name of your country, it will automatically create an email directed to them. So that is how you can contact the national leads listed there. I thought it would be better to just clarify these 2 points in the meantime. Okay, we have 2 more hands up. So Bahar Kanbay.
Hello, here is Bahar. I'm from Turkey. I'm hospital lead. Thank you, first of all, for your all efforts, and I'm really excited to join. I think I missed it, but is there a limit for the collaborators? I just wanted to ask that. I think I missed it.
So collaborators, up to 3 collaborators.
Up to 3, right? Is it the hospital lead included or?
No.
Up to 3, totally.
Excluding hospital leads.
Excluding hospital lead plus 3 collaborators, right?
Yes.
Okay, thank you very much. Thank you. Bye-bye.
Thank you. Okay, and I cannot see any more hands up. I think there are a few questions in the chat that have been replied by you, Teddy, as like other people were asking the same questions while we were speaking here. I think so. I guess if you want to just summarize like the 5 key things that people should take away from this meeting, I think that would be a good wrap up. Yeah.
Yeah. So these are registrations so far, but I think key things, we need to start working on ethics. And that involves finding out, first of all, if you need a national ethics or if your hospital ethics alone is adequate. So whatever works locally for you, it's time to start working on that if you haven't. Like I said, we'll be sending the minis team registration links over the next 48 to 72 hours. So please look out for it. It would either come to your inbox or go to your spam or junk. So please have a look at it or look out for it. And then if you can help with dissemination of the study to colleagues, if you are on any pages, WhatsApp page with other doctors who might be interested in being involved with this project, we'll be glad if you could help to share that. The other thing I want to mention is we'll be having other subsequent meetings, and those would likely be regionally, which means that for people in Sub-Saharan Africa, we'll organize a hospital leads meeting for you. For people in Middle East and North Africa, people in Oceania, Americas, etc. So we'll organize those meetings regionally so that we can choose an appropriate time where everyone would be able to attend the meetings. The last thing I would say is if you're having any issues at all, if it's something that's local, first point of call would be your national lead. If you don't have a national lead, then you can email the generic email alligator.org and we would at globalsearch.org and we would respond. It might take a little while because we have like lots of emails coming through, but we are working through them and we'll get to you. Yeah, I said that was the last thing, but one last thing is we will create hospital leads WhatsApp group. And that would also be regional. So for the different regions, we'll create a WhatsApp group because that helps to sometimes answer questions fast if we're not responding to emails quickly enough. So we'll send that link via email to you soon, and then you can log in there as well. And then if you have any questions, share with us. Maria, is there anything you?
Yeah, so there is one more hands up. Tushar?
Yeah. So I have a couple of questions. The first one is the individual consent of the patients. Is it required, not required?
Sorry, what? The consent.
Individual consent of patients.
Also, so the consent from patient, because it depends on how you register the study in your local setting. So for example, in the UK, we are registering it as an audit for hospitals in the UK, in which case you don't need to ask patient consent for it. If you're registering in your hospital as not as an audit, but as a research based on what is required locally, then you would need patient consent for that, especially if you are part of the sub-study, which involves asking patients some questions, then yes, you'd need the consent form for those.
So how do we decide if we are going to the sub-study or not? Is that you who is deciding, or that we have to think of beforehand?
So that's a decision by the hospital leads. Yeah.
Okay. So that's the first question I had. And now I have a pediatric surgery department in my hospital, whereas it will be difficult for me to coordinate with them and take the cases. So in that case, can I just include the adult patients?
Okay, very good question. Sorry, I should have touched on that earlier on. So if the adult service, so what you're describing sounds like the adult service is different from the pediatric service, which is what happens in some big hospitals where there's no communication sort of, because there are different teams who are performing the surgery and seeing or managing these patients from adult and pediatric perspective. So in that case, we've allowed for the pediatric team, for example, to register for the study separately to the adult team. What that means is that the pediatric team would have their hospital lead and their co-lead. So the pediatric team will be sort of a different hospital, even though it's the same hospital, and the adult team would be the same, would have their own hospital lead and co-lead. Does that make sense?
Yeah, it makes sense. But my question is, so what if the pediatric team is not interested in participating in the study at all?
No, that's fine. In which case, when you are registering when you're expressing interest, when you are filling in that form, you just indicate. So there's a part that says, are you taking only children? Are you taking only adults, including only adults, or are you including both? In which case, in your case, you just choose adults only.
Okay. So suppose the adult department has suppose 8 units in a hospital. So coordinating 8 units will be difficult. So is that some particular units can go into the study and the rest may not, or it should all the 8 units have to participate?
Well, all the units would have to participate. If you have a peculiar problem like that, it will be, I mean, we can talk about that separately. If you have, so I'll be happy for you to just, if you just email and then just say that we would look at it.
And the last question I have is, we had a site survey for the penguin study of one department. So when I was about to do the site survey for Dragon, it was not required because I had already the site survey was done. So that for the penguin, my site survey has been done. Do I have to do the site survey again for AlliGatOr?
Yes, please. The site survey is mandatory, and the reason is the questions are likely different.
Okay.
Yeah. So we require that the site survey is completed.
Okay. Thank you.
Thank you. Thank you, Tusha.
Thank you. There is one more hands up, Jersam.
Yeah. I'm from Ethiopia, and I actually asked a question earlier, but it was answered. I have a different new question. Actually, I'm a pediatric surgeon, and my colleague is.
We stopped hearing you.
Guess some. We can't hear you.
Okay. May I continue now?
Yes, I can hear you now.
Okay. Okay. So my question is, we are both consultants, and the way I managed it was, so one of us will be the lead and the other one would be a co-lead. But from the description that you just gave, I think we can both be leads and we can have co-leads because he is an adult surgeon and I'm a pediatric surgeon. So can we kind of change in that direction, or can we continue by being a hospital lead and a co-lead?
So yeah, thank you for your question. So what differentiates between the two scenarios is if the adult service is completely different from the pediatric service. So for instance, you might have in a particular hospital where you have a pediatric surgeon and an adult surgeon, but then they all run on calls, meaning the adult surgeon would still operate on pediatric surgeon, or is this?
No. Yeah. No, our hospital is completely different, and actually we have a separate
ward for pediatric surgical patients. So the pediatric surgical patients are going to be managed by pediatric surgeons, and the adults are going to be managed by the adult surgeons. So
Okay.
I think it looks like two different hospital.
Yes. In which case, then you would have a hospital lead for pediatrics and a co-lead, and then same for adults. So I would, it depends on how you filled in the form the first time. So I presume you filled it in and said you were going to collect for both adults and.
Yes, I did that, but the way I managed it earlier was I would be the hospital lead, and my friend will be the co-lead. So in this way, he would collect those data from the adult side, and I would be collecting those data from the pediatric side. Actually, we can continue in the same way if it's allowed. We don't have to create a new hospital lead and a co-lead. We can still continue as me being hospital lead and he being a co-lead if it's allowed.
Yeah, I mean, if what we want is to be able to capture every consecutive patient coming in.
Yeah.
And if you are having two separate teams in even different hospitals or different sections, then it's difficult for a mini team in one section to be able to capture all the data that's happening in the other section. So that's why we allowed for hospital leads in those two separate places. So I think the easiest thing would be to have a separate team for the kids and then a separate team for the adults. Moving forward, I think if you just send an email with the subject title saying that this is what we've discussed in the meeting, then we can take it from there.
Okay, thank you very much.
Thanks.
Thank you. In the meantime, there is also more two hands up. Hala?
Hello, everyone. Can you hear me?
Yes.
Yeah.
Yeah, so I already noted that in the chat that the national leads list on the website is not accurate. But I also want to mention that since I'm the national lead of Jordan, there's another name listed. So I'm not sure if it's not updated or there's like something wrong with the names.
Yeah, Hala, we will update it.
Okay, so it's not just not updated, but it's also the wrong name. So I just wanted to note you about that.
Yeah, that's fine. Thanks.
Okay, thank you.
And Ayman Hamid. Yeah.
Hello, everyone.
Hi.
I have one question regarding the patient consent. I'm a pediatric surgeon, and we need to sign the corresponding or the parent for every patient for data collection, or just a verbal approval from the parent is enough.
So the consent form is added because some people might need it, some people might not need it. It depends on how the study is registered in your hospital. If you don't need the consent form, you don't need to use it. We only added it to everyone because some hospitals might want this project registered as a research as opposed to an audit, in which case they may require patient consent for both adults and kids. So you don't need to use it if your hospital doesn't require it. Secondly, if you decide to take part in the sub-studies, then definitely you need the consent form, in which case the parents signing it is enough.
Okay, thank you.
Okay, thank you. We also had a few more hands up in the meantime. I just thought it could be helpful, Teddy, to just review one thing, which is there is the main study, that has been registered as an audit in the UK and that has been registered according to each country's regulations. And then there are the sub-studies. And I think here it's where probably some misunderstandings are quite easy to emerge. So for the sub-studies, as you can see, for instance, the economics sub-study, you will need to ask some very direct questions to patients. And I can imagine that for that one, if you want to take part, there is a high likelihood that you will require ethics for that. And that's why we have kept it open as to hospital lead's decision if they want to take part or not, because we can see that sometimes you might not have the time to ask these questions, for instance, or sometimes you just don't want to ask these questions directly to the patient, especially because it is directly to costs of care. Why are we still doing this sub-study, considering it can be perceived as something quite sensitive? Is because, as Teddy did some work in this area, data around catastrophic expenditure is one of the indicators that has less data from around the world. So we wanted to tackle this with this sub-study in specific. So that's the main reason, just to give a bit of context to everyone in the call. Why are we doing that sub-study? And then the waste and sustainability, also very specific questions, more related to waste management and to drapes and gowns and consumables, also adds a bit of more effort from the teams. So it also is your decision if you want to enroll in this one or not. I just thought it would be, because there were lots of questions regarding this in the chat as well. So I just thought it would be helpful to clarify these 2 points, Teddy. And then there is one more hands up from Dr. Jalal.
Hello, this is Dr. Jalal again from Saudi Arabia. So my question was, what's the difference between the co-author and the collaborator? Is the collaborator, he's the same one like collecting data, the mini team or mini group? Thank you.
Yeah, the leads are different or could be different from the collaborators. Yes, the collaborators are taking data from patients. In some places, some people would want, some co-leads will want to still take data, in which case they would be listed both as a co-lead or a lead and then also as a collaborator. But the collaborator's job would be to collect the data, and they would all be recognized in the roles they played in a study.
All right, thank you.
Yeah.
Okay, perfect. Teddy, I don't see any more hands up. I think in the chat, me and Liam tried to cover, and other people as well, because sometimes the questions were repeated. So I saw that there were some hospital leads also answering some previously answered questions, and we really appreciate that help. So I'm sorry if there was not anything that was not replied in the chat. If you still have any burning questions, please email. I can see that there is one saying about patient compensation for those participating in sub-study. No, there is no patient payment or anything regards to involvement of the study. Involvement of the study is completely voluntary, and yeah, there is no patient compensation for that. I think the way we try to explain this to patients for them to see why it would be important for them to take part is mainly to provide the data and to inform governments and people who are in managerial positions of the healthcare, because this data is usually used to then inform of what are the things that can be improved in the future, and mainly serves to advocate for change. So even if it doesn't have a direct impact in that patient, hopefully this will produce an impact in future patients that face the same condition as they faced. So yes, And then I think, I don't know, Teddy, how do you think about timing? Do we wrap up the meeting now? Do you want to answer a couple of more questions? I can see only one more hands up here.
Maybe we can take that one, and then, like I said, we'll have subsequent hospital leads meeting, and then we can address those. But if there's anything that's burning, a burning question, you can please email that. So we'll probably take the last question.
Okay, so last question, Malak.
Good evening. I'm a co-lead, and after registration, you asked for an email address to send the confirmation email. I put mine, and I keep receiving emails that are supposed to be sent to the consultant lead. Even the Zoom meeting link was sent to me and not her. So is that putting a problem or something?
I'm not sure why the consultant lead isn't receiving, because we send the emails to it. May probably be that there's maybe a glitch in the email, because once we send the meeting links out, we normally receive like a lot of wrong email address. This email is not working. So maybe it's worth checking first if the email address is definitely correct. If it is definitely correct, you can email us with that information that, okay, this particular email is not receiving the meeting details, and we'll rectify that.
I have a Gmail and she has a Yahoo. Is that a problem?
I don't think that should be a problem. If you just send us those details on the AlliGatOr email, we'll have a look at it.
Thank you so much.
Yeah, okay, perfect. Just one last question from the chat, which was, can one consultant oversee 2 centers collection in the study or participation, working in one center and supervising another center? So I think the consultant needs to work in both hospitals that they are registering for hospital lead. But there is no problem in you being the consultant that leads to different sites, but you need to work in both of them. I hope that answers that question. Okay, Teddy, I think no more hands up as far as I can see. So yeah, I think this was a very good meeting. And as you said, I think it's a very good sign that for this study, we need those regional leads to do like specific regional meetings, because what this means is that the network is expanding, and that is very good, because the power that the data that is being collected is been increasing, and therefore the impact that all of this can have is getting higher and higher and higher, which is very exciting. And I think having meetings with those regional leads, it shows a good sign for the future. And I'll leave it to you to finish the meeting. Thank you. And thank you all for your questions.
Yeah, thank you. Thank you very much, Maria. And thank you all for taking time out to come for this meeting. And we're going to put up the recording on our YouTube. It's AlliGatOr study on YouTube. We'll upload the link there so you can have a look at it, especially when it comes to filling in the mini team details. And we'll send some PDF or slides of how to fill it as well via email for those who would prefer that. So you can easily complete it. Thank you very, very much for coming, and I'll see you at the next meeting. Thank you.